to be here. I'm really grateful to Patricia for inviting me to share with you all where we are with the Rudy Study. Can you just put your hands up if you've heard about the Rudy Study? Keep your hands up if you're part of the Rudy Study. Great. So I'll spend about 15 minutes discussing the Rudy Study and then I'll hand over to the panel. So I'm going to go through why we set it up, how we've set it up, and what the future holds. And it really comes down to a patient-centered approach to research. And I was introduced to this by a patient in clinic where, as Professor Ralston pointed out, we just don't have the evidence of what to do. And my training is in studying the natural history of diseases, and I use this as an opportunity to set up the Rudy Study. And basically what patients want, they want new treatments, so they want to be involved in research to find the new treatments and to test the new treatments. But importantly, we've got to make sure what we develop is actually fundable within the NHS. Better information from the patient all the way to the specialist. That's vital, and it's incredible in this era of the internet how so many patients struggle to find the right information. And finally, better care. Right from the beginning, an efficient and timely diagnosis to effective advice all the way through to late life.
And if you look at osteoporosis, which Stuart mentioned before, and you go to NHS Choices, which is the patient portal for information, there's loads of information. There's videos, treatments, and also advice on prognosis and what will happen in the future. And there's even a sort of a guide for doctors to go onto. So if they have a patient with osteoporosis, they can click on different boxes and be advised what an expert would say would be routine care. What happens with osteogenesis imperfecta? Put it in, and the first hit is joint hypermobility. And you have to go to that link to actually find out the Brittle Bone Society and OI. So it's indirectly found in the NHS Choices. So what do the doctors' websites say? Because the doctors may face patients with OI in an emergency setting or in a routine setting. Where do they go for information? So I went on the Royal College of Physicians website, and the only link is on a book on non-accidental injury. And on the RCP, so the physician's website, where we have lots of information, there is no information. So there is a disconnect there with what the professionals and the non-experts are discussing in terms of information, and that can't persist. The best site is probably Wikipedia, and actually it's not too bad. But that's not where we should be expecting our doctors to go for information. And we have to make sure the information is available throughout the life course, from pregnancy, advice on childbirth, early years, schooling, careers, having a family, and then retirement. And we have to make sure the information is available to everyone, from patients to GPs, hospital doctors, and also specialists. So how do we achieve this? Well, there are two fantastic research projects happening right now in the UK that are going to help us achieve this evidence base. And the first project I'm going to discuss is the Genomics England pathway. So before I start, how many people here know have been tested for their genes for OI? So very few. And of those who've been tested, how many know that anyone in the family, they found the mutation? So a few people. So Genomics England is a project run by the NHS within England. So unfortunately, it only applies to patients where your GP is registered in England. And I know people earlier mentioned that genetic testing is quite expensive. This is a shortcut. So Genomics England will provide for free genetic testing for all OI patients if it hasn't previously been done and a mutation has been found. And that's very new, and we're working with the BBS right now to work out how we implement this. But very soon this will be available. And it's really in 4 steps. First of all, if no one in your family has had genetic testing, then you're eligible. Or if you've had the genetic test, they couldn't find the mutation, the change in the gene that causes your OI, you're also eligible. We only need one person in the family. It doesn't have to be the youngest, the oldest, just has to be who wants to give a sample. If you're not sure, then ask to be checked and be referred. And we're working with an information leaflet for GPs that will be on the BBS website. You can take to your GP to say, look, I think I might be eligible for this project. Can you refer me? And they'll then refer you to a genetics clinic where they'll give you more information, answer any questions, and if you're able to join and agree, then you'll give a simple blood test. And it does take some time, but eventually they'll either tell you, we found the gene, this is the gene that causes your OI, or we haven't found the gene, join a research group to find the gene. And this is a fantastic opportunity. And the vision is that most patients with OI within the UK will know the gene that's causing their OI. So what do you do with that information? Well, first of all, you have to access the GMCs. And like Stuart's map of everyone in the TOPAZ trial, these are all the centres that are currently working within this project. And there should be one near you, and you can be referred to one at the nearest to you. There's no boundaries here. At the moment, it's only working within England, but I know NHS Scotland is looking at this seriously. So once you've got your results, so what? You've got a piece of paper that says you have this genetic mutation. But we think it'd be really important. We know, looking in the room, OI affects people differently. Do you need to have your neck stabilized? Why do some people continue to fracture in adulthood and some people don't? Why do some people go deaf at an early age and some people don't? Some patients develop a very severe spinal curvature and some people don't. The heart problems. But excitingly, it might actually tell us which drugs will work best for you. It might be the type of mutation you have will actually tell us whether you need to go into the TOPAZ trial or another trial or not have treatment because the treatments aren't developed yet. And that'll be fantastic. And it might also show us new drugs. We might find a mutation where we weren't expecting it, and there's already a drug for that mutation, and we'll be able to treat patients in that group as well. So we really think this is an important step for all patients with OI. The key thing now is to make sure we're recording the number of fractures, how old you are when you're going deaf, have you got back problems and heart problems. And this leads me on to the Rudy study. So we did a Skype with our patient group, and there were three main bugbears people had. First of all, they were fed up of going to the hospital and having to give a list of all their fractures over and over again. Because even though it was recorded once, if they changed hospital, even if they changed departments, the information disappeared or wasn't easily accessible. So they wanted a patient diary. They wanted to clear up the bad data on the internet, and they also wanted to try and get control on the fact that different hospitals treat patients with the same diagnosis and same severity differently. They wanted to make the care much more uniform. It doesn't matter where you go, you receive the same care. So to achieve this, we set up the Rudy Study. And the main features of the Rudy Study, it's an online study. It's got a very good user interface, which we'll ask our panel later. And it allows a two-way link between patients and researchers, and it works. Because we know that to study rare diseases, we have to study everybody. It's not just the people who live near Edinburgh or Oxford or Cambridge. We need everybody. And we do know that at some sites, patients are only offered access to local research studies, and patients want to be offered all the research because they know without that we can't get the improvements in care. But patients also need to see the benefits of taking part in research. I had a patient clinic, she had a very rare syndrome. I looked it up on the computer, we found the gene. She was actually in that study and no one had told her. So she still thought it was an undiagnosed condition, and that happens a lot. So we wanted to break that. So the Rudy Study, a few minutes on that, it's really dead easy. You Google Rudy Study, you find the link, and you click on the link, and it gets you to this web page. And then you select on the library on the top right, and it shows you everything you need to know, how to register for the study, and all the study documents and consent forms. When you sign up, you simply fill in the information of who you are, what your diagnosis is, and if you're not sure, you can type it in. So you can even type in brittle bone, and we'll pick that up. And then you tell us when we can contact you to give you more information and ask you questions. And you put it into a diary, and if none of those dates are good, then you suggest other dates, and we will then get in touch with you. We'll phone you at a time convenient for you, give you information, answer your questions, and offer you consent. It is a research study, so it's up to you to decide whether you want to give consent. For children, it's up to the guardian or parent. You then need to go through a tricky bit where you need to send us a written form, either electronically or by the post, with your signature on it, to say that you want to take part in the study. And that then gives you full secure access to your own Rudy site. And on your page, you have lots of things you can do. There's a to-do page, which lists all the questionnaires to complete. And these questionnaires I'll come on to later are really important. They measure quality of life, which Stuart mentioned before, but also pain using 2 questionnaires, sleep, tiredness, anxiety and depression. And we'll send you email reminders how to complete them. And you can complete them on your computer, on your iPhone, on your other smartphone, on your tablet, in the morning, in the evening, over dinner, before you go to bed, when you wake up, whenever you want. It's really flexible. The next thing we've done is to put in a timeline, and basically it allows you to record all your fractures. And some of you may be thinking, gosh, that's going to be really hard. I've had hundreds of fractures. How do I do that? Well, we've worked with our patient forum and made sure it's as easy as possible. So we've made a map. You click on the bones that are affected. So say if it was a rib fracture, you select which rib it was if you know what it was, and then you enter the data. Alternatively, you can select on more than one bone if you know when it happened, and then fill in the data. If you're not sure, here someone from 1980 to 2000 has broken their upper arm 12 times, their legs 5 times, and their lower arm 4 times. So you can put these rough numbers in as well. It just gives us a feel for the number of fractures. We've tried to make it as easy as possible for you. And eventually you'll get a timeline, which will be the sites in which you've had the fractures, and then what tests and what treatments you had. And then you can use this in clinic. Patient came to me in clinic, they didn't know I ran the Rudy study, and I asked her, when was your last fracture? She pulled out her phone and showed me her timeline and said, look, it's all here, you look it up. If you want to write it down, you can, but all the information's here. The other issue is feedback, and we're passionate about this, and we've introduced a profile page, which, as well as all your information, has contribution to research. One of the rules for anyone using our data is once you've published something, you have to write a special piece that goes onto every person's website whose data has contributed to that piece of information. So you know immediately how your work in working with the Rudy study has improved care. Finally, I'm just going to start on the dynamic consent. Usually when you take part in studies, you fill in a form, you sign something, and then it disappears. I still don't know where people put it. It just disappears. As doctors, we have to take great care of it. We put all that information online. So you know at any point what you've signed up for, what samples and what data access you signed up for, and you can change your mind. If you don't want to have access for your data for other people, you can just say, at the moment, I don't want access. But importantly, you also agree to how you want to be contacted, not only about the study, but for other studies. So as trials come out in OI, we will email all the OI patients to tell them about Stuart's study and other studies that are coming on board. So if you're not sure what studies are going on and you register in Rudy, you'll be automatically told if you're eligible and also where to get more information. So I mentioned the patient forum. Without them, Rudy wouldn't work, and the Brittle Bone Society and the OI group have made a fantastic contribution to that. What do? We have a Skype every 8 weeks, which is challenging to log into sometimes, but everyone gets it. And all of this has come from the patient forum. We've changed how Rudy runs, we've added in sleep, we've added in recruiting partners to see what the effect of looking after someone with OI has for them. We've gone on to Facebook and we're on Twitter. Security is important, and all the information is locked down behind the Oxford University website. So it's all secure and it's safe. So how far have we got? There are over 500 patients with rare diseases of the musculoskeletal system in Rudy already, and that includes 108 OI patients and overall over 4,000 questionnaires. They've just been filled in by participants over time. What happens to the data is a question I've always get asked. It is available to anyone. So whether you're a doctor, a researcher, a patient, or a patient group, You can write to us to access the data. It goes through a pathway, and then once that request has been approved, the data is then made available to you. So the data is free to be used, and we want it to be used. So what has the data shown so far? All this information, where have I got to? So we've shown that the quality of life of patients within Rudy stretches across the whole spectrum. On this picture, you can see quality of life from 0, which is equivalent to death, to 100, the best imaginable. And you can see we have patients in the blue line with OI, mostly with quite good quality of life, but some patients who have quite low quality of life. And this is important for studies. We've also found out which bits of quality of life are most affected by OI. And here you can see in blue, no problem, green, moderate problem, and red, severe problem. And the biggest problem areas are mobility and pain and discomfort, with less effect on anxiety and depression and self-care. What do we do with this information? Already we're changing practice. So our very clever health economist, Rafa, has worked out if you had a treatment that made the worst people in OI get 75% better, how much will the NHS be willing to pay for that treatment every year? And that information is vital when we're designing new treatments. The last thing we want is to get a really cool treatment that's too expensive for the NHS. And this is the number we come out with. And this is the number that groups can then use when planning, is this test actually and treatment actually going to be viable within the NHS? So already it's affecting NHS care. So where are we going? Soon, if not today, there's going to be a diagnostic module available for you to look at. And that will go through how you were diagnosed and what were the diagnostic delays. We've now got permission, so you can actually, if you've got no problems during the study, you don't have to have the telephone call. You go straight through on the website, and you're allowed to register into the study. We're adding not only fractures, but also operations, complications, and other diagnoses. We worked out an economic module, so you can actually put in how your rare disease affected schooling, your employment, health and social care for you and your family. And finally, we're working on a very cool family map where you can map out who else in your family has OI. What's the vision? So I'm a little bit ambitious, as people know me. I think this is a great opportunity. Genomics England has offering genetic testing for everyone in England with OI. Not everyone will be eligible, but wouldn't it be fantastic if everyone was in Rudy? Because then we could collect all the information about all your life events, and that could then be used to predict what might happen in the future, so we could take preventative therapy. Also, that information could then be offered to researchers for specific studies looking at new treatments and new tests. And by doing that, we can then, instead of giving a blanket treatment to everyone, give patients personalized treatment and the best evidence care for you. So that's my vision, that everyone should have the opportunity to contribute to Rudy. So in summary, Genomics England, a fantastic opportunity. Watch the BBS website for details. Patricia and I, we're discussing the wording. It's got to be simple and it's got to be effective. Rudy is working, it collects natural history and timeline. We'll hear more from our patient group, and there are new features coming online. Finally, I'd like to thank the group I work with. I'm a very small cog in a massive effort here to improve care in rare diseases. And this is the Rudy team, and we meet every Tuesday morning to discussing. It's a very small team, and we're really grateful for our patient group partners for helping us get this far. So now, in the minutes that are remaining, I think we'll just hand over to the panel here to discuss how they've got on with Rudy and answer any questions. Thank you very much for your attention. So, are there any questions?
Hello. I have questions at the point. It's very interesting, and thank you Dan for sharing it. In terms of potential, I mean, a lot of it obviously is going to be very helpful in terms of kind of helping clinicians to decide where to spend money in the NHS, but there's a huge amount of potential, I think, in terms of the developing social care and quality, the whole thing, the whole gambit really when it comes to if you've got OI as a child and then you go through that plateau of from your mid-teens to menopause, where you're basically left alone and nobody has a clue what's going on with you, and then you kind of come back to it, and you find that actually at this stage now with the cuts that there is nothing. And nobody's really planning ahead for what's happening to, people my age and what happens with the condition. And I can see Rudy being really useful in developing that and working on that. I haven't kind of engaged with it until today, but I've certainly looked at it closer.
I think that's really important. And that's why the economic module specifically asks for social care. So we're going to build a special thing for social care to see. But let's ask the panel. So I'm going to ask them, why did you join Rudy? How easy was it to join? And what feedback have you had so far being part of it? Go, Penny.
So I joined Rudy because I wanted to know what was normal for someone in my position. So if you're this height and you've had this many fractures, if I got pain in my back, is that normal for my type of OI? Or is that abnormal and that needs to be looked into? Is that just going to be part of my life in the future, or is it not? Is it something a bit different? And for me, I love Rudy because, again, the fracture timeline is brilliant, because there are so many times when you don't bother to go to A&E, you don't need to, it's like a broken rib, they can't do anything about it. But you write it down on your thing, and actually, it's surprising how many fractures I've forgotten about, even within 3 years sort of time frame. And I'm like, oh, okay, I thought I was doing really well, but actually, I have had a few more fractures than what I remember. So I find that really useful, but it's just for the future, really, of knowing what's normal and what's not. I think that's what I want out of it.
Well, I joined Rudy because I wanted a centralised database for all my medical needs, because I have, even in Bristol, there's 2 major hospitals and I have operations at both, but they don't share the information between them. Don't know why. But with the Rudy database, you can put it all into the one thing, and then doctors from both hospitals can access it and find out the medical history for themselves without me having to tell them. So it's really good for that.
And I joined Rudy. I've got XLH, X-linked hyperphosphatemia, and I joined because I have 3 sons with the condition and 2 granddaughters, and a bit of a guilt complex, I think. My parents didn't have it, I was a mutation, and we actually have had our genetics done, and our genetics are on a database that is held in Canada, but nobody seems to have the same genetic, the same genetic fault. So, but I joined. I'm interested in the research. My experience of it, before my age, I am quite computer literate. I have struggled with it a little. I think even one of my sons has struggled with it, and he is obviously younger and much more computer literate. But I have made friends with, I think it's David Gray, over the last couple of days. I only knew I was coming here a couple of days ago, so I was doing my homework to catch up with myself, as it were, and I did find little hiccups, but David is super. There is a little icon that you click on to send your feedback. I think yesterday I sent about 3 or 4 little messages saying I don't understand, but David then replied, and there are little bits to iron out, but it's quite fun doing it. I think it's super, and one of the other things that I hope it will bring together, with XLH, we have never had, there is now a formal network in the States, and this must be about the 5th year that they have had a meeting. We've never had one in the UK. I was actually 55 before I met anybody else with the condition, other than, of course, my children. And the fellow that I met was 53. He had chosen not to have children, and he lives in the States. He had never met anybody with the condition. And I think if something like this does tend to bring people together, it's not a bad thing. The first trial is now happening in the UK for a drug for XLH, and through Rudy, one of my sons has been enrolled on that. Whether he would have, no, in fact, his particular hospital had asked him as well, but he actually joined it through Rudy. He was first aware of it through Rudy. Yeah, I thoroughly recommend it.
Thank you. Are there any other questions? I have actually left the registration pamphlets at the registration desk, so you can find out more information. But we're happy to take any questions.
I'm already in Rudy with you. We haven't had genetics tested and stuff. But I was just going to say that on the diary for fractures and things, I find it quite difficult because I don't necessarily always know if it is a fracture. So I'm just wondering, does it matter if it's not completely accurate? So I couldn't tell you which bit.
Oh, that's fine. We're not expecting you to...
Not necessarily the time span exactly. Do you know what I mean? I don't keep track of everything, and I don't have them checked, so I don't know.
Actually, doctors find it just as hard to find out which rib's broken and what time span it is, so that's completely fine. Our main advice, do the best you can. Because at the moment there's very little information out there, and the more information we collect, then it can go forward. So if I know ribs are a big problem. We don't have a system in the UK for how to manage rib fractures. They tend to be, this rib fracture will get better with time, but there are things you can do to diagnose and treat them.
Things like, if it's not just a fracture, so if it's a crack, or like a hairline fracture, so for me it's still very painful, but it lasts not as long as a full fracture. So put that in.
Yes.
As a fracture, but
Yep.
then put a note.
Yep, you can add notes as much as you want. There are free text boxes. That's a very important point. Penny, do you want to say anything to that?
Yeah, so going back to that point as well, kind of going back to what I was saying as well, like if you do put a fracture in and then it also tells you how you dealt with that fracture, and it's really good keeping an eye on what drugs you had. And if that worked because you healed quite well and you had a healed fracture, then that's good to know for the future. But also, obviously, unhealed fractures is quite a common problem as you get as an adult. And actually, I think for me, that's going to be quite important for like research to be done into. Okay, so if that was unhealed, what drugs did they have? Have they been on promigenate? And hopefully, we can sort of understand why you're getting unhealed fractures. Is it treatment or is it not? And I don't think there's any baseline previous treatment, what's normal, what's not. So I think, again, really going to help unhealed fractures as well and how we deal with it.
Sorry, I missed part of the presentation. I just wondered about confidentiality with the Rudy Study and who actually has access to the information.
That's a very important point. We're very serious about it. So basically, your personal data, only two people can see. You and David Gray, the administrator. The researchers never get access to your personal details. If you're sent, if there's a trial going on, we just email you with the trial details. We never share your data with anyone else. And on the dynamic consent page, with all those green ticks and red crosses, you can change who has access to your anonymized data as well. So you have full control of your data. If actually you just want to keep it for your own use, you can lock down your entire data set and none of it's used for research, and you're just using Rudy for you, if you want to do that. Because some people, we respect that everyone is different, and we don't want everyone to follow the same sort of privacy rules. Everyone has different sensitivities, and it's very flexible, and you can change your mind whenever you want. Health profession, only researchers will be able to access the website. If you want to share your screens with your doctor, you can, but this is a research endeavour. So patients often come in with printouts or with screenshots of their timeline. But no doctor will ever be given your login details. I don't even know who's in Rudy. When people bump into me, do I know that they're in Rudy? Because I don't have access to who's in and who's out.
I actually have a question.
Yes.
Some of it asks whether you would consent to, if you have any surgery for bits of body, to be used.
Yes.
How does one actually go about that?
So this is preparatory. So Rudy, as you can imagine, is a very small team. But if a researcher then came in and said, we want operation leftover bits for people with XLH, we can then give them a list of patients who have said yes to that,
Right.
and then they will then go to that hospital and say, Mrs. X has said yes. Do you have any leftover bits of Mrs. X from her last operation? And then if they say yes, then they can take them. And actually, we linked up a researcher from Edinburgh with a doctor in southeast England with a very rare condition through Rudy, and they then got samples, which has really helped her research, because it's a national project.
Hi there. I signed up to Rudy when we first started it, and I just wanted to know about the fractures, which I'm ploughing through because I'm actually 62.
And I was a spontaneous mutation. So very rare. Anyway, when is it, or is it envisaged, the blood tests, etc., will, you know, I don't want to call myself a patient, but is it likely that it's just going to be an odd sort of proportion, or will we be called up to do blood tests?
So blood tests are offered to a subsample, and it will really depend, as I said, with the surplus tissues. A researcher will come up and say, I need blood from patients with OI. We'll go through the OI list and see who's consented to it, and then we'll write to you and say, actually, this researcher wants access to your blood, and we've got permission to take the blood from your GP surgery you can go to, or your local hospital research centre. What Rudy does is sets up a framework, a system whereby other researchers can then get ready access to rare disease patients. Otherwise, the researcher would have to find all the patients with OI and then consent them for the blood test. We've done all of that. We're just there ready for them when they want to do the research.
Thank you very much.